Well, hello. Thank you for your time on today. I am Naquilla Thomas, currently serving as the department chair for the Department of Dental Hygiene through the College of Health at Clayton State University. Today's presentation is strictly for educational purposes only. All resources utilized in this presentation is cited on the last slide of this presentation. So today we're going to talk about how to empower your smile. We're going to elevate women's health through oral health and go into a little bit of detail about what that looks like and talk specifically about some preventative measures. A little bit about myself. The most exciting part of my job is I get to train students to become dental hygienists. And in a dental office, when you go into a dental office, you get to meet the dentist and his or her staff. And so a dental hygienist works directly with the dentist in developing a treatment plan of care for patients to understand what it is to develop and maintain oral health. So what I do is I train upcoming dental hygienists. And so we are the ones who teach our patients about preventative health, and we care for the foundation of your smile, which are your gums, the health of your teeth and gums. So we educate and train on keeping your teeth for a lifetime, because ultimately the health of your teeth can have a direct impact on your overall health. So it's important to understand those different dynamics and what that looks like. And so again, in training the upcoming students, we are helping them to spread the word of dental hygiene, but also be a part of the profession of dental hygiene and training everyone on preventative health care. So throughout the presentation, we are going to dig deeper into defining what oral health is. So we were going to look at that as it relates to the U.S. Department of Health and Human Services, the Office of Women's Health. They define oral health specifically. So we're going to look closer into that. We will also take a look at some statistics, some data that's been published by the Centers for Disease Control, CDC, and Prevention as of May 2024, actually, some very timely and updated statistics. We'll also go through the stages of oral health and disease, as well as gum disease specifically and how it affects women and women's health. Lastly, we'll definitely talk about some prevention and share some helpful resources. So throughout the presentation, as we go through each topic, there will be some FAQs that pop up. So it's our frequently asked questions. That's what FAQ stand for. And so it kind of gives us a greater insight into each of these topics. So the U.S. Department of Health and Human Services Office of Women's Health has a dedicated section specific to oral health. And there are various resources for oral health specific to women's health. And again, I have cited those on the last slide. But we're going to take a closer look at defining oral health. So what does that mean? Oral health is the health of your mouth. So it includes your teeth. It includes your gums and the supporting structures of your teeth, the throat, and the bones around the mouth. So several health problems such as gum disease, that it may be a sign of other things systemically that could be going on inside of your body, not just some infections don't originate in the mouth, but they can manifest themselves through things that you see in your mouth. So gum diseases are infections that are typically caused by plaque, which is a sticky film of bacteria that forms on your teeth. And so if this is left untreated, it does cause structural damage, which affects can destroy the tissue and the bone around your teeth, leading to tooth loss. Infections in your mouth can also affect your unborn baby if you are pregnant. So there are various stages to the disease process. And so when we'll go a little bit deeper into what that looks like from a preliminary state, how plaque, as it continues to sit on your teeth, how it builds and it forms calculus, but in common terms, we call it tartar. You may have heard it as tartar buildup. And so it's important to remove those plaques because our research has shown that that type of plaque and tartar buildup can be found in other areas, specifically when we talk about arteriosclerosis or the building up of plaque and bacteria. So there is a connection. A lot of research has shown there is a connection between that. So we're going to look a little bit closer at some stats published by the Centers for Disease Control. Many children and adults experience poor oral health due to common oral diseases such as cavities or tooth decay and periodontal gum disease, both of which are leading causes of tooth loss. So in the United States, more than half of children and adolescents aged 12 to 19, about 57%, and almost all adults 20 or older, 90%, or more as age increases, have had cavities in their permanent teeth. And so this is decay, dental decay. They've had some form of experience with cavities in their permanent teeth. So although dental sealants, which is a preventative measure, can be used to prevent cavities, less than half of the U.S. children aged 6 to 11, about 42%, have dental sealants on their permanent teeth. So not only do we have these statistics as it relates to the high population of people that have these experiences, there are preventative measures such as sealants that I just mentioned, yet a very low percentage of the population have even have these sealants or have experience with preventative dentistry. So about 34 million school hours and 92 million hours. These are very high statistics that are illustrated here on this slide in terms of the school hours and work hours that are missed yearly due to unplanned emergency dental services. So about roughly $46 billion of U.S. productivity is lost yearly due to untreated oral diseases. And so having these statistics, having this information helps us to kind of see a picture of where we are in terms of the disease status of oral health and how we need to promote that and have a better understanding of where we are oral health wise, but also access to care is an issue as well. And so again, at the very end of this slide, I have included a link to charitable dental clinics. So there are charitable dental clinics in the state of Georgia. So when you deal with situations where people can't afford dentistry and or there's not a dentist in the area, then there are certain sites that can be accessed to find some charitable clinics or areas where you can receive services. But specific to gum disease in women, pregnant women, about 60 to 75% of women pregnant specifically have experienced some form of gum disease, and children of mothers with these high levels of untreated cavities or tooth loss are more than three times likely to have had cavities as a child. So what you know as a woman, what you know as a mother is typically what you pass on to your children. And so that's what research has shown. And so we want to make sure we understand the statistics, understand how prevalent decay is, gum disease, and what that looks like in terms of statistics. And so while oral health affects our ability to do things like eat, speak, and smile, again, it is connected to your overall health, because I began stating early on that what you see in your mouth may not be an origination of a gum disease or an infection of the gum. It could very well be a manifestation of something that is going on inside of your body. For an example, we'll go back, when we talk about what may be going on in your body, we can look at poor periodontal gum disease can worsen with glycemic control in terms of people living with diabetes. You can look at there's a growing number of studies showing that people living with certain chronic conditions may have more untreated oral diseases or conditions. And I always like to say that when you come across people that are experiencing poor oral health, missing teeth, it's not always that they are just negligent in their healthcare in their oral health and their brushing and flossing. That's not always the case. It could very well be a systemic condition, something going on with their bones, something going on with their other conditions that they may have that are being not controlled well, or that's out of their control. And so we always are very careful not to pass judgment, because again, it is what you see in your mouth is very well indicative of what's going on in your body. So when we go into the stages of oral health and we look closely at the various stages of periodontal disease and health, in a healthy mouth, you're going to have firm and resilient tissue. The tissue is going to be a pinkish color. Now, you will have some melanin depending on your skin type, and so you could have some gingival coloring, as it mentions here. And gingival is just another name for gums. So some gum coloring occurring depending on the patient's complexion and race. Evidence of previous disease may be present, but ultimately in a healthy stage of oral health, there will be some firmness, some tightness, no bleeding. I always use the analogy of if you're brushing your hair and you see blood on your hairbrush, that means something is going on. So when you're brushing your teeth, there should be no bleeding at all when you're brushing your teeth. And so when we move on into the stages of periodontal disease, gingivitis is characterized by inflammation. You'll see some color changes, and you're certainly looking at the position and the surface of the gums. And specifically, if you're brushing and you notice bleeding, bleeding is always a sign that something is not healthy. And so gingivitis is the mildest form of periodontal disease. It causes the gums to become red, swollen, and bleed easily. And there's usually little or no discomfort at this stage. So luckily, gingivitis is reversible with professional treatment and good at-home oral care. So when we're looking at the stage of gingivitis, again, it's inflammation. It is reversible completely, because any terms with itis at the end, itis just means inflammation of. And so the gingivitis is inflammation of the gingiva, which is inflammation of the gums. And so with proper brushing, flossing, that will certainly reduce that inflammation. Again, with professional treatment, the dental cleaning, having your teeth cleaned on a regular basis, which is typically recommended twice a year, or more if you have underlying health conditions. But ultimately, you getting your teeth clean, you're doing your proper brushing and flossing, that gingivitis is completely reversible. Now, if gingivitis is not treated, and or you experience advanced you can experience advanced stages, let's just say, of gum disease. And again, this could totally be out of your control, because there could be some systemic conditions that are causing this continuation of a progression of periodontal disease. And so periodontitis is untreated. Gingivitis can advance to periodontitis. I should say that's not what it is, but it can advance to periodontitis. And so with time, plaque can spread and grow below the gum line. Toxins produced by the bacteria and plaque irritate the gums and stimulate a chronic inflammatory response, in which the body essentially turns on itself, and the tissues and bone that support the teeth are broken down and destroyed. Gums separate from the teeth, forming pockets between the teeth and gums that can become infected. So we're looking at the early stage of gum disease here in terms of periodontitis. So I will use these terms interchangeably, periodontitis and gum disease, because when you get into the periodontitis stage, you're no longer at the surface level. Now we are involving structures of the teeth and bone. And so or in the early stage of periodontitis, we are looking at gingival inflammation, so that inflammation continues, but also we're getting into the deeper periodontal structures or the gum and bone structures and the crest of the bone, and then you start to exhibit bone loss. And there's usually a slight loss of connective tissue, and that connective tissue is that attachment for your bone area. So if we look here at the x-rays between these areas, here you can see from a healthy standpoint, and then we go here and you start to see the bone is still at a great level. So that's why gingivitis is more inflammation. But when you start to go into these advanced stages of gum disease, you start to see the bones resorbing. And that, again, is a direct indication that there is bone involvement and that gum disease is starting to progress. And so, again, there are various stages, excuse me, early, moderate, and advanced. And so at the moderate stage, again, this is a progression. This is a more advanced stage of the previous condition. And so there is a noticeable loss of bone support. And there's also an increased opportunity for a visibility that you can see of tooth mobility. So the teeth may become more mobile. And then there's also a possibility where there could be multiple teeth in an area that are losing bone that's surrounding that. And so the more advanced stage beyond the moderate would be what is further progression of the periodontitis, which is the bone and gum inflammation. And so with this major loss of bone support, it is typically accompanied by tooth mobility, because you got to think about the tooth being set in the bone, and you're losing bone in those areas, and that in and of itself is going to be some visible, obvious tooth loss. And so you could have that. So in terms of what you see in this document on this illustration, there again are advanced stages in the continual bone loss. It's just a progressive area. And so it's typically classified, periodontitis is typically classified by stage and grade. And so after a thorough assessment, so we highly recommend an assessment. We call it a comprehensive periodontal assessment. And so some of you may have gone to the dentist, and the hygienist or the dentist has taken a ruler, which you can kind of see in this picture here. We call it a probe. And that instrument has markings on it. And what it does, it kind of gives us an idea of the stage and grade. Where are we in terms of the depth of that bone and where it sits at the gums? And it gives us an idea of the stage. And so with that assessment, there are an assignment of a number or a stage ranging from initial to severe, and that describes the acuteness of the disease process. And so additionally, your dentist, your periodontist, a periodontist is a specialized dentist who is trained specifically in the periodontium, in the gum and bone structure. So you have various specialties within the profession of dentistry. And so depending on who you see, that dentist or periodontist or the hygienist will perform this assessment, which is going to give you an idea of where your teeth and bone are in relation to the stage of health, or the stage of gum disease as it relates to inflammation, and or whether or not it has, the progression of the disease has gone into the supporting structures. And so it's important to get that assessment and have an understanding of what that means and what that looks like. So what are some of the common signs and symptoms of periodontal disease? Well, periodontal disease is often silent, meaning the symptoms, particularly pain, may not appear until an advanced stage of disease. And so, however, you should still be on the lookout for these signs and symptoms, particularly red, swollen, tender gums. And again, when we're looking at the gums from a surface standpoint, and you know your body, you know whether or not you go to the dentist regularly or you get your teeth cleaned regularly, and or hormonally as a woman, if you're dealing with various times of the month or seasons in the year, stress level, some of these can be directly related to what you may have going on. And so aside from that, which we'll talk a little bit deeper in the next segment, and excuse me, the next slide, we're going to talk a little bit closer about puberty and menstrual cycles and so forth. But just from a general standpoint, periodontal disease, you will notice you may not have any pain originally, I should say, early on, initially, you may not have pain, but as the disease progresses, you will start to have some discomfort. But ultimately, any red or swollen or tender gums, pain in the mouth, bleeding when you're brushing or flossing, gums that recede or pull away from your teeth, um, causing the teeth to look longer because the gums are starting to pull back away from the teeth. And that in and of itself can also be attributed to aggressive brushing. So not using a medium or hard toothbrush. You should use a soft toothbrush. Now, this is another analogy of what I like to say. I always use the analogy of mayonnaise. So if you were to waste mayonnaise or something soft, ketchup, whatever, soft, you wouldn't use a Brillo pad or anything aggressive to clean mayonnaise or to clean ketchup or something something really soft. And so plaque, when it first formed, it has that same consistency. It's soft, it's sticky, but it's not hard. So to use something hard or abrasive, it would just basically smear it around. It won't really clean it, but it also causes damage to the teeth. And that's what we call recession or toothbrush abrasion, where the gums start to pull away from the teeth. And so you have that in advanced stages of gum disease, but you also have that in healthy patients who just are aggressive brushers. So it takes some time to get used to, but a soft toothbrush is effective, and it's actually more effective than any medium or hard. So I just wanted to say that because we did have that statement here about receding gums. But also with gum disease or periodontal disease, you're going to notice some loosening or separating of the teeth. You'll notice some sores in the mouth, possibly some persistent bad breath, a breath odor, which is indicative of disease, a change in the way your teeth fit when you bite, also a change in partials or dentures. If you wear partials or dentures, you'll notice that there's some shifting going on. And a lot of times, again, with periodontal disease, it's silent and the bone is just progressively resorbing. So again, if you notice any of these signs or symptoms, it's always best to see your dentist, see your periodontist, which again is a specialist for gum and bone, right away, because at a certain point, there are certain measures that can be taken to rehabilitate, to stop the disease process or arrest the disease process and get you to a state where it can be maintained. How common is periodontitis? Well, the main cause of periodontitis is poor oral hygiene. That's the main cause. And bacteria cling to plaque and tartar on your teeth surfaces. And so if you don't clean your teeth as well as or as often as you should, bacteria can travel down beneath the gum line where your toothbrush and your floss just simply can't reach. And these harmful bacteria will erode the tissues that support your teeth, leading to infection, bone loss, and tooth loss. And so when we talk about the commonality of periodontitis, it affects more than 47% of adults over 30 in the US, and that number jumps higher to around 70% for those 65 years and older. And so that is how common the infection of periodontitis. So now we are beyond gingivitis, because that number for gingivitis, which is gum inflammation, has proven to be much higher. Everybody has a higher percentage rate of inflammation just from, again, we talked about different cycles that women go through life. But ultimately, gum and bone, which is periodontitis, the infection of the bone, is a pretty high percentage as well, 70% for adults 65 years and older. What happens if periodontal disease goes untreated? So in addition to poor oral health, periodontitis can result in poor overall health. Research highlights an important link between oral health and whole body health. People with periodontitis have a higher risk of developing heart disease, stroke, dementia, and other serious health conditions. With periodontitis, if it's untreated, if it's left untreated, again, it does advance and it does become more problematic over time. you are looking at digestion issues, when you start to lose your teeth, when your teeth become mobile, when there is infection or inflammation, there are various problems that occur if this disease process is not arrested or stopped. So again, mild periodontitis is, if left untreated, gingivitis, it turns into mild periodontitis. And at this stage, your gums begin to pull away from your teeth. Plaque and tartar bacteria continues to get trapped in certain pocket areas, again, where you can't brush and floss. And then that continues and progress to moderate periodontitis. And so that's when you begin to lose even more bone around your teeth. Again, the ligaments and the soft tissues that support your teeth begin to become even more distended or away from the teeth, and the gums become more sore and tender. And with severe periodontitis, which is the more advanced stage of that gum and bone disease, it becomes more severe and you continue to lose bone, where eventually the teeth do come out. They fall out. And so you, in addition to the bleeding, that inflammation, which occurs at every stage, but at this stage, you may even notice some pus or infection around the gum line, which that pus can contribute to the halitosis or the odor of the mouth. And so this is a real infection that is happening actively in the mouth that, again, it can affect your overall health. There have been studies and news stories of, unfortunately, people who have untreated infections in their mouth. It can be from a cavity, it can be from gum disease, that travel through the body and through to the brain, and ultimately it can be fatal. And so again, this is infection just like infection anywhere else in your body. Specifically, gum disease in women during puberty, an increased level of hormones such as progesterone and possibly estrogen causes an increase in blood circulation to the gums. This may cause an increase in gum sensitivity and lead to a greater reaction to any irritation, including food particles and plaque. And so during this time, the gums may become swollen, turn red, and feel very tender. And so again, in puberty, again, you're dealing with hormones, and that increase could cause some of this redness and swelling. And again, with gingivitis, it's completely reversible if that infection hasn't gotten to the bone. In menstruation, during those times of menstruation, occasionally some women experience menstruation gingivitis. Women with this condition may experience bleeding gums, bright red and swollen gums, and sores on the insides of the cheek. Menstruation gingivitis typically occurs right before a woman's period and clears up once her period has started. And so again, this is an inflammatory condition, and it typically clears up before or after, or right after it starts. And so there will be some noticing of that bright red swollen gums, and it's just hormonal, and it typically clears up before or right at the start. And so women who are menopausal or postmenopausal may experience changes in their mouths, and they may notice dry mouth, pain and burning sensations in the gum tissue, and an altered taste, especially salty, peppery, or sour. And so there are some oral changes that can be noticed in menopause and postmenopausal women. And so ultimately, or I should say women who experience those. And so ultimately, with those, there are several over-the-counter products that can assist with alleviating dry mouth, as well as any pain or burning sensations, products that specifically target those conditions. So how do we have another FAQ? How do women's hormones affect oral health? Well, changing hormone levels at different stages of women's lives can affect oral health. So we're looking at this influx, if you will, of hormones, and that attributing to swelling and irritation, also bleeding. And so the body's immune system is more sensitive than usual during certain stages of cycles that women have, from puberty to menstruation to menopause, postmenopause. And so that directly can be affected, the oral health can be directly be affected. So this can cause inflammation, again, the redness, the swelling, sometimes some pain and discomfort. Regular, careful brushing and flossing can lessen the gum irritation. Again, there are some products that are over the counter that will target inflamed areas. Um, Other causes of changing hormones that may affect your oral health include, we talked about the menstrual cycle, menopause, hormonal birth control. Certain medications that are taken can affect that, can have an impact on the hormones and oral health. So again, that part is known to be true and can be managed. It definitely can be managed, and we want to manage those areas so that we are mindful of the impact that it can have if left untreated. Um, let's see. So specifically to pregnancy, so there are hormonal changes that occur, obviously, during pregnancy, where there could be an increased blood flow. Where there is increased blood flow, many women may make women more susceptible to disease. There are some studies that have shown that pregnant women who have gum disease are likely to have a baby that is born too early and too small. So there are documented studies of preterm low birth weight um, babies that are born to mothers who have untreated gum disease. And so it's very important to understand that connection and to make sure you get ahead of that, especially if you I know here where I work at the clinic, we definitely have patients that come to the clinic, and we collaborate with their physician. We coordinate treatment, because that'll take us to our next FAQ. I'm pregnant. Is it safe for me to get a dental checkup? Yes. Tell your doctor you are pregnant. Obviously, your doctor tells you, however that goes. Tell your dentist, tell your periodontist, tell your dental hygienist, hey, I'm pregnant. And again, here specifically in most offices, 100%, you coordinate care, you work together, because it's important that you continue your regular dental visits, because that helps to protect your teeth during pregnancy and also has a direct relation to your overall health and the health of your baby. Because you are pregnant, your dentist may not take routine x-rays. The health risk to your unborn baby is very small. However, we like to do what's necessary and hold off on any elective procedures until after the pregnancy. So if you need emergency treatment or specific dental x-rays to treat a serious health problem, then your dentist will take extra care to protect your baby. Ultimately, we do what's necessary during pregnancy, and we would much rather take that x-ray, treat that infection, and before you go into before you have the baby. Obviously, we want to eliminate infection. And so again, we talk about coordinating care, we talk about the need to continue your treatment, and up until about the 20th week, according to Women's Health Fact Sheet, after your 20th week of pregnancy, you may be uncomfortable sitting in a dental chair. And so but there are different, I should say, alternatives. I know for myself as a hygienist, I've stood up and cleaned a pregnant mom's teeth just to make her comfortable and to make sure she gets the care that she needs prior to having the baby, because we know that if you avoid treatment, you may risk your own health and your baby's health. And so it's important to not avoid treatment, to get your teeth clean, to get rid of any infection that is manifesting itself in the mouth, and do what we can to make sure that you get your teeth cleaned and your checkups. So when we go into prevention, which is the fun part, because there are so many different ways to combat this disease process and to really take control of your oral health. We're looking at dental examinations and screenings. I mentioned earlier about this comprehensive periodontal evaluation. So if you go into your dentist and they just clean your teeth and they're not assessing your gum and bone health, then that might be a question that you raise and say, hey, what is the health of my gum and bones? Have you done a periodontal evaluation? Because that's important. You need to know what your numbers look like and how healthy are my teeth and gums? How healthy is that bone support? What are my x-rays looking like in terms of my bone support? And especially, I mean, it's important regardless, but especially if you already have underlying health conditions, that's even more important because your body is already susceptible to disease and infection. So you want to know those numbers. You want to know the health of your teeth and gums. You want to develop a great rapport and relationship with your dentist and hygienist because you want them to know, hey, Miss Jones, you were here last week and that or I should not say last week, your last cleaning, and we noticed you were reading at a 2, and this time we're noticing it's at a 4. So there's some inflammation happening. What's going on? And so you might be able to talk to your hygienist and say, hey, you know what? It's that time of the month for me. So maybe that's it. Or you know what, I haven't been flossing as good. So you want to be able to recognize these signs and symptoms and then catch that disease process before it worsens. And or if you're already at an advanced stage of gum disease, stabilize, get to a place where you have that relationship with your dental professional where he or she can help you to maintain that area. So brushing, flossing, rinsing 2 times a day. If you do it any more than that, that's fine too, but minimally at least twice a day. And again, using those soft bristle toothbrushes. I mean, some people may disagree with me, but I don't know how. Soft bristles are certainly effective when it comes to the early stages of gum disease. And even if you have um, um, that built up tartar, that heavy buildup, you can use a extra hard toothbrush and it will not come off. So that's why I say, ultimately a soft bristle toothbrush. Anything more abrasive than soft will again cause that tissue damage, cause that sloughing, cause that receding gum line. And two, when you notice that tartar building up, then that is definitely indicative of you needing to go to a dental professional because there's no amount of brushing that will remove that from your teeth. You'll have to get that professionally removed. Nutrition. Limiting your foods, beverages that are high in added sugars, no bedtime juices or milks, or even gummy vitamins, honestly, for children without brushing or rinsing afterwards. I have to be mindful of that myself. I have 2 young kids, and so when I give them their vitamins, and we typically do vitamins in the evenings, I have to make sure, hey, we're going to brush and floss after those vitamins because their pediatric dentist mentioned to me in which I didn't know myself. That was new knowledge for me. Even the gummy vitamins that are taken at night have some content of sugar. It's not intentional for some, I guess, brand makers of vitamins, but that's just as important to make sure you're brushing and flossing after those. And lastly, well, I should say not lastly, but next to last, discovering the connection between health conditions and overall health and oral health, because as we mentioned early on, that manifestation in the mouth could not necessarily be a result of your poor oral hygiene or your inability to reach certain areas. It could be a telltale sign that something else is going on in the body. And even some prescribed medications can directly impact your oral health. And so there are certain medications that are prescribed that can cause that dry mouth, that can cause that burning sensation. And so we want to be aware of the oral health side effects to medications that are being taken or prescribed as well. And always we want to spread the word of dental hygiene. Ultimately, dental hygiene, as I began the presentation, dental hygienists always sometimes get confused with dental assistants. Oh, they sit with the dentist chair side. No, dental hygienists in our profession, we focus solely on the foundations of, I should say, the foundation of the smile. We care for the foundation of your smile. So when you see a hygienist in a dental office, know their intent is to make sure your gums and bone and the teeth that surround the gum and bone that surround the teeth are protected and are evaluated, are assessed to make sure you're not losing bone and you'll keep your teeth. So we're spreading that word of dental hygiene. We're spreading that. So I've heard there is a connection between gum disease and other diseases. Yes, this is very true. The connection between gum disease and other system diseases has been long studied, and several research studies have indicated that gum disease may be linked to other diseases such as heart disease and diabetes. And researchers suspect that inflammatory markers have been seen in certain cardiac studies. However, inflammation in and of itself is the basis behind the connection between the relationship between gum disease and other diseases. So if we can keep inflammation down and at bay, that in and of itself is a preventative measure to arrest or prevent certain disease processes and the progression of thereof. So we want to make sure that we are mindful of that as it relates to the disease process. So some final tips and takeaways. Your mouth, it is the pathway to your body. There is a connection between the mouth and the body. And your gums are the foundation of your smile. So we want to empower your smile by caring for its foundation. And we want to make sure we get our biannual dental checkups. More frequent visits may be needed. Again, we talk very specifically about mothers who are pregnant, mothers who are nursing, children who have active dental disease, and people living with health conditions such as diabetes, cardiovascular disease, and other conditions that aren't noted. I think specifically about patients who have syndromes disease and other types of conditions that have direct oral implications or oral things that you can see in your mouth. So people with who are living with various conditions should definitely see a dentist regularly and their hygienist regularly for their dental checkups, as well as just more frequent dental care. And these resources we talked about throughout the presentation, ultimately having a list of places to go to look on the internet. These resources, I ask that you save them: womenshealth.gov, the CDC, the American Academy of Periodontology. So this is a group of, again, specialized dentists who study gum and bone disease, and they're the structures of the teeth and bone. And so there's very good information there, as well as Cleveland Clinic and that website that I mentioned, the charitable clinics, GeorgiaDental.org. If you click on that, or if you visit that link, I should say, that will give you insight into various clinics around the state of Georgia that offer various payment scales, and some services are charitable and at no cost or very nominal cost. So there are resources out there, and if I could be a resource to you, please do reach out. Dentistry is my passion. I'm excited about preventive health and sharing information. I am a registered dental hygienist. I am an educator of the profession of dental hygiene, and I'm just excited to have participated and share with you about dental hygiene and the health. And I hope that you all feel empowered and will continue to be empowered by your smile, and wishing you all a wonderful summit.